So now continue with the differentials. How will you differentiate from where this lump came from? So differential diagnosis. First would be a appendicular lump. Okay. So you should ask in the history about the short duration of pain, shifting pain from umbilicus to the right iliac fossa after some time, with fever, nausea and vomiting, and then the lump will form after 2 to 3 weeks. Second would be carcinoid, appendicular carcinoid. Because appendicular carcinoid is more common as compared to the ileal carcinoid. So ask about the abdominal pain, facial flushing during eating, and loose stools. So it's very important. Our third differential would be carcinoma cecum. So ask about the beside lump, ask about the weight loss, melena, diarrhea, unexplained anemia. This thing is very important, unexplained anemia, and repeated blood transfusion. So these questions are very important. Then, because the patient is usually came from the underdeveloped countries, so ileocecal TB is very prevalent in Asian countries. It's tuberculosis, ileocecal tuberculosis. So ask about the abdominal pain, which is because of the subacute obstruction. Usually after eating, the patient complain of the vague abdominal pain after eating. Then altered bowel habits, weight loss, night sweats, and evening pyrexia. Okay, then our fifth differential would be psoas abscess. So ask about the previous tuberculosis history and TB contact history. The patient have TB patient in the family. Lower back pain, lower back pain and lower back soiling, and difficulty in walking, because of lump. Usually the patient who came with the psoas abscess, they just flex their leg from the hip joint, so the pain will be relieved. And if you are trying to extend the leg from the hip joint, so they will shout or cry because of the excruciating pain. Okay, our sixth differential would be retroperitoneal mass. Okay, ask about the lower limb soiling, or you can see the edema, pedal edema, difficulty in micturition, and shooting pain from lower back to leg. Okay, if the patient is male, then you should ask about the undescended testes. Ask patient that the testes remain in the scrotum by birth. So this is very important. If the patient is athlete, to ask about athlete or is fond of doing gym and used to lift the heavy weights, then ask about the rectus sheath hematoma. So specifically ask about the weightlifting. That during weightlifting the patient developed that lump and then the pain has been developed. So it's very important. Line differential would be unascended kidney. So ask the patient that does the patient have any kidney problem by birth or congenitally. Okay, and recurrent urinary tract infection. Our 10th differential would be ulcerative colitis and Crohn's disease. So ask about prolonged history of loose stools or blood in stool. Ask about the steroid consumption and joint pain, and if long bone pain, and ask about the vision problems. Okay, if the patient is female, then ask about the pelvic inflammatory disease, uterine or ovarian pathology. Ask about the leukorrhea, foul smelly vaginal discharge, lower abdominal or pelvic pain, irregular menstrual cycles. Then 12th differential would be mesenteric cyst. Ask about the mobile lump in abdomen. Okay, then continue with the risk factors. Okay, ask about the red meat ingestion or low fiber diet, family history of tuberculosis, strong family history of the tuberculosis, family history of colon, breast, thyroid, CA, previous radiation exposure, and ask about the any kidney operation, kidney surgery, specifically ureterosigmoidostomy. So these are very important. Then continue with the systemic inquiry. In the CNS, ask about the fits, headache, altered level of consciousness, and blurring of vision, tinnitus. In the CVS, tachycardia, low blood pressure, and chest pain. In the respiratory, pleuritic chest pain, pleural effusion, difficulty in breathing, shortness of breath. In abdomen, ask about the jaundice, weight loss, melena, altered bowel habits, nausea, vomiting, and in musculoskeletal, ask about the long bone pain, lower back pain. So these are very important. So then come to the personal history. Ask about the sleep, appetite of the patient, malaise, anorexia, addiction to the betel nuts and alcohol, and maturation, bowel habits, weight loss, and pets in the house is very important. Then past medical, surgical, trauma, allergy, and transfusion history is very important. Then family history and socio-economic history. If the patient is female, then elaborate gynecological history. So these are very important. So now the topic is complete, and we will discuss another topic in my next video. And if you guys want to add some more questions, just comment in the comment section and subscribe my channel. We will meet soon. Allah Hafiz. Bye bye.